A very strong finding that has been replicated across many countries is that famines, particularly when a child is in gestation or in early life, has marked and significant effects in reducing health and economic well-being in adulthood. We don't know whether moderate changes in nutrition could lead to changes in long-run health and economic well-being, particularly when we can adjust these nutrition and make improvements through the use of government policies. I'm a scholar of the social safety net. I'm interested in redistribution, the welfare state, and particularly outcomes for low-income families with children. So in the United States, one of the key elements of our social safety net, or our welfare state, is called food stamps. And food stamps is a program that provides assistance for low-income families towards the purchase of, essentially anything in the grocery store. Because the food stamp program was rolled out across the 3,100 counties over a 10-year period, we've got dramatic variation in the access to this food stamp program across a population of adults. And so we can examine very finely the differences between having access to this food stamp program when a child was 1 or 3 or 10 or 15. We find that access to food stamps in early life leads to an improvement in health in adulthood, particularly what we call metabolic health, which is obesity, high blood pressure, diabetes, and heart disease. So we also look at the effect of food stamps on economic well-being in adulthood, and we look at outcomes such as education, earnings, and whether a family is poor. And what we can find, as you can see, is that women experience an improvement in economic well-being in adulthood due to access to food stamps in early childhood, yet we find no statistically significant effects for men.